Really what interoperability means is a totally coordinated health system. So at the moment we have different types of data stored in different places. Some is on paper, some are in disconnected IT systems. And the idea of interoperability is to bring all of that together in a single version so that a patient can have access to their complete health data. And importantly, not just the patient, but also the physicians and nurses that are treating the patient can also share that information and ensure that they provide good, efficient and effective service. One of the important things about an initiative like this is that we have a national strategy and a vision of how we're going to get from now to where we want to be in the future. And to do that effectively, we've got to coordinate all the different partners, and there are many different partners involved, from private sector to clinicians to the hospital systems. And so that's the role of Infoway really, is bringing together all those partners, helping them to work together on a roadmap to achieve this goal: seamless interoperability and access to data.
Every single country that has advanced this journey, they have actually done that, using a common centralized coordinated roadmap that actually helps them, one, align on the common priorities, but also deliver some of those common foundational capabilities that are required to advance the goal. Interoperability is an elephant on its own, right? So it's like, the only way to actually complete that goal is to eat that in bite-sized pieces. And we have taken a similar approach, with our interoperability roadmap. We identified 4 transformation programs, but underneath it, the 12 foundational capabilities, in bite size that will actually help us, get closer to the destinations. And I think people often confuse this roadmap as Infoway's roadmap. This is everyone's roadmap. This is, roadmap that belongs to all of us. And naturally, when we say it belongs to all of us, it cannot be done without collaboration. So all the jurisdictions, a number of other pan-Canadian health organizations, federal organizations, our vendors, clinicians.
Jurisdictions and clinicians alike would like to see immediate progress on some of the interoperability challenges that are facing the healthcare system, and what they would like to see is incremental change every 6 months to have a new capability running out in the market. So we're approaching it with very much practical means of solving for problems. So we're addressing it both from top down and bottom up. When you break up a very complex problem into its building blocks, now you're running the opportunity, and you have the opportunity to bring in the subject matter experts in that particular domain. So they don't need to solve for everything. They need to solve the best way possible for one single thing. And then if you do that, you will get the best experts to come up with the best solution for a particular interoperability problem. Now you created a building block. Then vendors can configure their products in such a way that they show capability for those modular technology pieces. And then using those modular technology pieces, jurisdictions can have procurement processes that say, I need you to be able to support A, B, and C. It will be literally a product of capabilities that vendors can show proof that they support by coming to projectathons such as this one, passing some tests in advance of actually their sales cycles. And so by the time something comes up, they're ready to go.
I think my hope is that it really does accelerate at a fast pace, and we start to see the immediate benefits of this, and that looking in the future, Canada becomes one of the leaders in this field.
We know where we're starting from, the percentage of Canadians who have access to their comprehensive health record. We know that it's really low. So we would like to actually see that number grow upward of 50%.